So what we went into was looking at what we currently had across our system, and Geoff, I'll leave you to cover those in more detail, about what already existed within our system and what did we want to do differently. This is what we're aiming for. And we're trying to use that narrative as a constant reminder when we're having a conversation about urgent care or estates or workforce, that these are the things that we're true to, and making sure that everything we do aligns back.
The model is essentially about these 5 things. So certainly the way I think about it is that if BSW ICS nails it, then it's about nailing these 5 things. So at the centre of the model is personalised care. Everybody in BSW should experience a personalised approach no matter how they're interacting with health and care services. So if you're a relatively healthy person and you want some advice on how to choose better things to eat or to access exercise, you can access that in a way that works for you, in a format that works for you, in a method that works for you, right through to if you're living with multiple long-term conditions and you've got your own personalised budget and access to a named team that knows you and is helping you to develop your care plan, that's personalised care for you. But we want personalised care to be almost the foundation of all of this. Everybody in BSW should be living in a healthier community. So the idea of that is that wherever you're living in the system, where you live helps you to live a healthier life. So whether that is by having, the things that we directly commission, things like good access to GPs and dentists, for example, through to, the place where you live, it's easier to ride the bike to work because we've sorted traffic out and there are cycle lanes, or there's good public transport options, or if you want to access education at any point in your life, that's easy to do where you live. If you want to go for a walk to improve your well-being, there are nice green spaces that you can get to and they're safe to walk in. If you want to buy fresh fruit and veg, you can do that on your high street, and it's not just a run of betting shops and chip shops. So the healthier communities bit, that's where that's the main sort of prevention part of the model, I think, and where I think there's loads of opportunity to join up across things that we do in healthcare, but things that our colleagues in local authorities do. For example, planning transport, planning health and leisure services, planning education. Those healthier communities should be supported by joined up local teams. And one change that we made in this version is that we put the healthier communities, the personalised care and the joined up local teams all in the same circle to show that those joined up local teams should be really embedded in those healthier communities. And the joined up local teams bit, the 2 parts of that are really intentional. So joined up, as in no matter who's paying your wages, you can work together in that team. So your laptops will be able to, you can use your laptop in each other's buildings, you can share data, it's easy to email each other. We get rid of all those organisational boundaries. And the local part being that the teams are really set up and tailored for the local populations they're serving. So the intention is these joined up local teams would be at the neighbourhood level, which will be really different in central Trowbridge to central Bath, for example, or rural Wiltshire or central Swindon. Then when you need access to specialist services, there are much more local specialist services available. So, you may be able to access things from home through virtual consultations. You may be able to access things closer to where you live at a community diagnostic centre or an outpatient clinic at your GP practice or something like that. And then when you need to go to a specialist centre, they're there for you. But because of these other parts of the model, in the future, the specialist centres should be able to focus on the things that only they can do. I can think of lots of NHS examples of that because that's my background, but the specialist centres part is not just about acute trust, it's about specialist centres run by the local authority, it's about the hospices in BSW that are specialist centres run by voluntary community and social enterprise sector, so that is supposed to be a broadening.
The focus around ICSs has been on the organisational and the change associated with that. We're trying to really put it back on, no, this is about the care, the way it operates, and that wider determinants of health that Geoff alluded to. Turn what's a nice concept, a glossy image, into some very tangible delivery. So we haven't delivered this yet, but that's our sort of aspiration and goal. And it's allowing us to have a joined up conversation that we're heading in the right direction together.